you want to look at a child's breathing at night, and you want to make sure that they're breathing with their mouth closed and they're breathing through their nose. If there's any mouth breathing that's going on, that needs to be corrected immediately. Any teeth grinding, any snoring, all of that needs to be corrected immediately. And the sooner it's corrected, the better off the child's going to be. Because the longer that those breathing patterns go unnoticed, then the mouth and the oral cavity is going to develop based on those functional patterns. So if a patient is mouth breathing with their mouth open and they're not able to breathe through their nose, it's going to create a very narrow, long face, and it's not going to allow for enough space for the teeth to come in their proper positioning. But if we're able to have nasal breathing and the tongue resting on the roof of the mouth, then that tongue formation resting on the roof of the mouth is going to put pressure on the bone to grow in such a fashion that teeth will eventually have the space to come in the proper positioning.
Be minimally processed. Hey, Dr. Carlie, thank you so much for doing this for me. I'm so excited for our episode. So let's just start with the first question. Let's start with your story. What led you from choosing traditional dentistry into choosing a more holistic approach? What was that specific moment that changed everything for you?
I think it wasn't a specific moment where I switched. It kind of happened gradually, but there was things that came into my life that started to expose me to what I call more of the truth of dentistry and how the oral microbiome and the health of the oral cavity is related to the rest of the body. So originally, when I was going to school, I was studying for the MCAT because I wanted to be a medical doctor. And at the last second, I decided, all right, maybe I should explore dentistry, and I'll kind of get into why. So once I decided I wanted to go into dental school, I picked a random dentist in my hometown and I shadowed him, and he had to have had mercury poisoning. So he had been working for 40 years or so, and he had kidney failure because his mercury levels in his body was 9 times what the Environmental Protection Agency would allow for a human to be exposed to. And they told him that he would never practice again, and he was basically on his deathbed. So I was, I guess I was like a junior in college when I shadowed him, and he was talking all about mercury and the silver fillings that people have in their mouths and how it's very toxic, and that if I go to dental school, I need to get my levels tested before dental school and then get them tested after, like the level of mercury in my system. And I was working for a dentist at the time who had went to dental school with this dentist, and he had told me that he was a little bit radical, kind of that he used to speak at the dental school, and they asked him to stop speaking because he's a little bit too radical in his line of thought. So I didn't really know exactly what he was talking about, but I remember being very amped up, like about mercury and silver fillings in the mouth and how it exposes you to mercury. But then when I went to dental school, we, just kind of brushed over mercury. It wasn't really discussed or even thought that it was a big deal. It was just like, okay, mercury is inert once it's in the mouth. So we place it in the mouth, and you're supposed to be careful handling it, but once it's in the mouth, it's completely fine. And so, and we had to do mercury fillings, and they're called amalgam. So it's like the silver fillings in the mouth. It's called mercury amalgam
Yeah.
fillings, and they're 50% elemental mercury. So we had to do
Okay.
them in school. We did them regularly. We had exams on them. It was a requirement for dental school. Um, so when I was in my third year of dental school, I kind of was getting a little bit bogged down in school, and my friend and I were looking for something else that was kind of gonna connect us to what we were doing, and we found the
Mm-hmm.
National Academy of Oral Medicine and Toxicology. And I started reading their website, and I was like, hold up, this is talking about mercury. And I remembered the dentist that I shadowed in college.
Yeah.
So I realized that he was a part of the organization, and everything kind of started to click from there. And one of the reasons that I was even looking for something different is because I was in dental school and I was going through my own treatment. So at this point, I already had braces 2 times, and I ended up getting into braces a third time, right? So, and because my bite was messed up, And I was in school trying to inquire about why my bite was the way that it was and what was going on. People, even in the dental school, really couldn't answer the questions. They were just like, oh, you're just a very odd case. Most people are kind of like this. And we would learn the rules of what most people were like. They were like A, B, C, D. And I didn't fall into that category of A, B, C, and D with the way that my bite was presenting itself. So when I got a scholarship to the International Academy of Oral Medicine and Toxicology, the IAOMT, and so when I went there, I listened to a lecture on the bite and how the teeth come together, and it was the first time in all of my training that anything made sense. So then I started diving deeper into that, into those I guess ideologies or ways of thinking.
Yeah. That's a very interesting story, because you know, braces are very common, right? I think when you're a teenager, it's kind of the norm where you kind of fix your bite. You just get it for a prettier smile, more so for aesthetic reasons, but also for, as the commonly said, bite issue. But then you also mentioned amalgams. I think we have a lot to unpack from your story. So let's start with amalgams. What is the common misconception for amalgams, and what is your point of view of the mercury associated with it? Is it good for us? I know as a doctor, they're harmful for you from the story that you just shared with us, but for the person who's actually, almost ingesting it, because it's in our mouth, so that means we are ingesting it. What harm, if any, does it do to us who potentially could have an amalgam or get an amalgam? And what's your stance on it?
Yeah, so actually the ADA came out with a statement in 2020 saying that amalgam fillings should not be placed or removed in pregnant women, women looking to become pregnant or of childbearing age, any child under the age of 6, and anyone with neurological disorders or kidney disorders. But everyone else that's outside of that category, it's completely safe.
But
So
how is that? They're also human, right?
exactly. So it's like 6, not okay, but at age 7, it's completely fine. You see what I'm
Okay.
saying? And
Yeah.
I think that was a huge feat in our argument against mercury amalgam fillings with the ADA
Mm,
putting out that statement, because it's showing that these are not good for our body. This is not good for our body,
right.
and it's definitely not good for people who have it in their system. Um, you know, because they claim that when you put the mercury amalgam in the tooth, once it sets, it's completely inert and there's no mercury vapors being released. But using various technology to measure mercury vapors, and you put it next to someone's mouth who has mercury fillings, and it goes off the chart. So the and also whenever you're eating, the mercury amalgam fillings will expand and contract. And so do composite fillings, like tooth colored fillings. Those will expand and contract as well, but at a much smaller scale than the silver fillings. So on one hand, they're in the tooth, they expand and contract, um, and they create little minute fractures down the teeth. So what you'll see is someone who had those fillings in their teeth for 30 years, they'll end up with a cracked tooth because those little fractures end up causing the tooth to fracture off at some point. So that's one problem with the fillings. Number two, when you're chewing and you're eating, if you're grinding your teeth, and the hotter the foods that you eat, the more the mercury vapors are released. And mercury vapor is odorless, colorless, and tasteless. So you aren't exactly aware of it. So you're breathing it in, and it affects the heart, it affects the brain, the kidney, and the gut tissues. And it's Hg2 plus, right? So on the periodic table, mercury, right? So it's very reactive, and it can replace other enzymatic markers that are in your body to properly function, organ systems in the body. So sometimes people, and it is a neurotoxin. So the more mercury fillings that you have, the worse off you are. And if you grind your teeth or if you're eating hotter foods, then the worse off you are. So I think it is important for people to consider when they're looking at their overall health and they're having health issues, I think looking at the mouth and looking at if they have metals in the mouth in general, but especially mercury, if that would be a contributing factor to what's going on in their health.
Yeah, that's a great point. So why do doctors even start with the option of someone needing these fillings? Like what what has to happen in our mouth in order for us to even qualify for that?
So it it actually, one of the things is driven by insurance, because Medicaid
Mm,
and Medicare will cover mercury fillings, but
okay.
they won't cover the white fillings.
Like
So
does it is it required because, someone's tooth is chipping off, or is it like cavity? Like what is the driver for getting these fillings?
yeah, it's if you have a cavity. So when kids,
If you have a cavity, okay.
mhm. And a lot of places they're not placing them anymore, which is nice, but still some places are.
Mm.
Like for example, at the dental school that I went to in New Orleans, they are still placing mercury fillings, and it's still
Still
part of
education. Yeah.
it's still part of the educational system. I do know there are some dental schools that have eliminated it and made it optional, which is nice.
Mm.
But there's plenty of schools that are still requiring people to do them, which means people are still getting them, you know? One of the reasons I think that they were so readily used is because it's when you use white colored fillings, you have to have complete isolation in the mouth. You can't have any saliva present, or it will cause leakage and it'll cause them not to bond properly. But with mercury fillings, isolation is not as required. So it's easier for a dentist to place them when it's harder to get isolation, or when it's on a child and it's even harder to get isolation because they're a child. So that's, I think that's why they were readily used over white fillings.
Okay. So, is there a better approach that we could take in terms of solution when we get a cavity? What's the first thing we should be doing instead of getting a filling?
So if you have the beginning stages of a cavity, there are things you can do to help remineralize the tooth structure, because the tooth is made up of multiple layers, right? So the outside layer is enamel, and that is made of um, hydroxyapatite crystals. Okay, and when that breaks down, that's where the tooth is going to primarily break down in the enamel first. And when there's a cavity beginning in the enamel layer, so the outer layer of the tooth, before it gets to the second layer of tooth structure, there is a chance that you can remineralize it. And you can use different remineralizing agents to do so. And those would be things like hydroxyapatite nanoparticles or toothpaste with hydroxyapatite in it. So um, that can help. And then also eating nutrient dense foods and making sure that you're cleaning your teeth well. Things that can help prevent the need for having a filling done. However, if it's already reached that second layer of tooth structure, which is called the dentin, then that is where bacteria can take over, and it's important that you consider getting a cavity like filled at that point. And there are plenty of composite options to do so. There's no reason your dentist should be placing mercury amalgam fillings at this point.
Wow. So let's say someone is in the stage 2 or stage 3, like you mentioned, where a filling is required. Um, Now that we know mercury is bad, let's say, whoever's watching this episode and or whoever has that awareness that we shouldn't get a mercury filling, but need some sort of a solution to, fill that cavity. What are some, I guess, better for you options? I know you mentioned clear. What are some options, and like, what are the implications, if any, for those?
So there's a ton of different techniques out there on doing um, composite fillings, which are the tooth colored fillings. I have kind of I've do what would I say? I have kind of gone into what would be the best option for patients, and I think there's multiple options a patient can choose. But me personally, the way that I treat a tooth is I look at a tooth like a little organ. They're organs. They're little organs in our mouth. So anytime you drill on that organ and you are putting a burr to that tooth and you're removing tooth structure, you're putting that tooth at risk. So for me, it's very important that when I go to remove cavity, a decayed tooth material, like the decayed tooth structure out of a tooth, I only want to remove what is necessary. And I want to let the body do the rest. So, me personally, the way that I do a cavity is I remove the cavity that's on the peripheral layer, on the periphery. So, only damaged tooth structure or decayed structure that is in what's called the DEJ, which is where the first layer of tooth structure and the second layer of tooth structure meet. So that this may be getting technical, but this is just what I do. Yeah. So, and the purpose for that is so that I don't drill too deep into the dentin, the second layer of tooth structure, and I don't get too close to that nerve because it's enamel, dentin, and then you have your nerve, which is called the pulp. And you don't want your burr, the drill, to get too close to the pulp tissue because if you're too all of that movement is going to disturb the dentinal tubules that communicate with that pulp tissue. And you put the tooth at risk for the nerve eventually dying or needing a root canal to survive, right? So I only take the decayed material out of the periphery, and then whatever's in the center that's close to the pulp, I blast that with ozone gas to kill bacteria, virus, parasite, and fungal material organisms that may be in the area, any microorganism in the area. So we kill it, and then I put a filling material in that is BPA free and fluoride free, so that there's no leaching into the tooth or into the person's body.
Yeah. How does ozone therapy help in that process? Is
So,
it something like a one-off situation, or do you recommend that for from time to time?
so I do ozone anytime I work on a tooth. I'm always putting ozone on the tooth before I put it filling in. Anytime
Okay, specifically during filling situations,
I
basically.
actually put ozone gas on the tooth, like, and it just
Oh,
into the tooth and goes into the tubules.
okay.
So that's one situation. If a tooth has been worked on and it was a pretty big cavity, or the tooth is at risk for having, maybe it was just a lot of work done on that one tooth, then maybe the patient will come back periodically for ozone infusions. So you can get ozone therapy. A patient can also have ozone sinus insufflation done or ozone ear insufflation done as well to bring ozone to the entire head and neck region. And so that gas will bring oxygen to the tissues and kill bacteria, viral, parasitic, and fungal cell walls without harming our human tissue cells if it's utilized at the proper concentration.
Yeah, in conventional dentistry, right? We don't hear the implications of what's happening. We just hear, you have this issue, this is a proposed solution, and that's it. The education is something that, as a patient, we have to do. And I think that's where a lot of the issues come in, right? Because we're not aware. And so it's like we have to go out of our way if we care, if we even know the implications of them. If not, it's almost like there's no other way. So when it comes to mercury toxicity or these amalgam fillings that you're talking about, is there a way to get them removed? Is there a safe removal process?
Yeah, I think it's important to look into getting them removed safely, especially after meeting many people who have had mercury poisoning over the years and have had negative effects um, to being exposed to mercury. For an example, I had a classmate in dental school who ended up losing her sight in one eye for a little while. She had had lack of sleep, but they also found high levels of mercury and aluminum in her system. And she had like an optic nerve inflammation in one of her eyes. I feel like that's an example of mercury coming into play in someone's health. I've seen dentists develop tremors just from being exposed to mercury day in, day out for the years before knowing how bad it is for you. Um, so I think that although maybe some people would be fine, it's kind of just like one person goes out into the sun and they're fine. Another person goes out to the sun and they get a sunburn. I think everyone's genetics do play a role in how much they are affected by certain things. And we see that across the board in anything regarding health, just like how some medications work on patients, other ones don't. So we do see a variation in genes, but some people that have certain genetic mutations in their genome where they can't methylate their DNA or get rid of toxins as easily, they're someone that may want to be more cautious about having mercury in their system. And then when it comes to getting it out, they want to be more cautious about how they remove it. So in practice, I try my best to keep the patient and myself as safe as possible. So we have a few different protocols. So when a patient is getting mercury removed, we do an IV therapy the day of the procedure. We also do, I have an HVAC unit that comes directly up to the mouth to help, suck up any vapors that are released during the process. We always use a rubber dam, which is, I don't know if you know what a rubber dam is, but it's a little uh, piece of material that will clamp onto the tooth so that the rest of the mouth and the throat is blocked off and there's no
Mm,
particles that are getting down the throat that the patient's swallowing and the patient's not getting exposed that way. The only thing that's visible is the one tooth that we're working on. I even put
yeah.
a material so that none of the tissues are visible. All I see is that tooth in the mouth. And then we
Wow.
have two suctions. We have slow speed suction and high speed suction. Um, and then lots of water, very, very, a lot of water. And the patient is completely covered. So we cover them with PPE. So they have like a bib, a blanket, all that that's going to get thrown away afterwards. And then before for the procedure, we do charcoal rinse and swallow. And then after we do a charcoal rinse and spit. So that's just to remove the mercury. And we clean the entire room and the entire area afterwards before we set back up to replace the tooth structure.
Yeah. Wow. There's so many things that, we're not aware of that we really need to look into. I mean, when you talk about health, we always talk about the food we eat, the, supplements we're taking, but very less about our mouth, right? Like we get braces, root canals, like all these are normal now. Invisalign, right? So I think I definitely want to talk about all these things that we have normalized over the years, and also want to know what implications these have. So let's start with braces that you mentioned earlier. So tell us about the things, the misconceptions, the good, the bad, the ugly, everything about braces that not everyone knows about.
Well, first say that, I'm not an orthodontist. So there's some, I can only speak from my level of training. I didn't go to orthodontic school. However, I am a patient of orthodontics and a multiple, I've gone through multiple treatments. And I've seen this over and over again in patients as well. I think that there's a time and place for ortho. I think it's important to have orthodontists in our corner when we need it. But I do think that braces historically focus mainly on moving the teeth, right? So they look at the teeth, and a lot of times orthodontists are not looking at the jaw joint, and they're not looking at the airway, and they're not looking at the reason why people's teeth are crooked to begin with. So, and I do think that having braces on at a early age, like the brackets with the wire, having a patient who's in, like 10, 11, 12, they're still in their growth phase and they have everything bound in, like in locked in place, that palatal suture. I
Yeah.
do think there are some implications on the spine and the neck later on. That really
Wow.
hasn't been proven or made a strong connection yet. Um, I'm not sure if this is answering the question, but essentially, I think it's important to focus on a child's growth and development before the age that braces comes into play. And because over the past 400 years, we've noticed a lot more crowding happening and our jaws shrinking. So we've noticed two things. We know an increase in the need for wisdom teeth to be removed because of room. and then an increase in the need for orthodontics because there's not enough room for teeth to come in straight. And some of this may be evolutionary in a sense, like we may not be able to fully prevent this from happening. It's happening on the evolutionary scale, But I think it's a reflection of how malnourished a lot of us are from an early age. And that's with the introduction of pesticides,
Mm.
processed foods, our busy lifestyle, not sitting down and being mindful of what we're eating, not chewing enough, not eating hard enough foods, all this baby food, not breastfeeding, and the mother being malnourished when she's pregnant for their her child. So I think all of these things play a role into how our mouths are developing.
Wow.
Yeah, I
We
must admit.
no, it's a lot. I think there obviously, when you go into root cause healing, root cause medicine, it's never one or two things. It's a holistic approach, and I think you hit everything. It's not just what you do in childhood, but it's pretty much from preconception or conception too. Um, yeah, yeah. Yeah, and I think we live in a world where toxins are everywhere, and that doesn't help either. It's like where do we start? What do we be more mindful about? Um, but at least it gives us some understanding that look, we're getting braces or we need braces, even if it's for aesthetic reasons. But still, what is causing for that? Like you said, that the wisdom teeth or like that crowdness, whatever they want to call it. So I think finding a holistic dentist, right, and start from there.
Yeah, and I actually like to, when patients come in, I try to look at their airway and how
Mm,
big their mouth is and how much space they have for their tongue to function. So when I was going down the path of my own path with getting braces for the third time and my bite not making any sense the way it's aligning, I was like, how can I continuously need braces when I'm wearing my retainers and I'm doing what I'm supposed to do and my bite is still messed up? And it sent me down a rabbit hole that brought me back to the airway and how the tongue functions in the mouth. So I think there's a way you can actually look to see how much space there is for your tongue to function. And braces may come in at some point, but I think the first step would be trying to increase the foundation that you have. And you can do that through appliance therapy and opening up the jaw
mm.
and actually growing bone to create more space for the tongue to function and exist.
Yeah, I've actually heard of this company called Tooth Pillow. Have you heard of them?
Mm-hmm.
I don't know the scientifics of it, but I've seen so many statistics on how they're really improving the space or increasing the space, which in turn increases airway, just, rest of the tongue and things like that. So could you tell us a little bit about how that could be a better option, especially for, kids and at adolescence age, because, we don't want any external, what's the right word? External um,
Intervention.
additions. Yeah, interventions. Exactly. Yeah. I think we need to find some things where they're growing while using more holistic approaches to creating what they need to, function and thrive. So could you tell us a little bit about, maybe companies like Tooth Pillow and how holistic dentistry is probably a better option?
Mm-hmm. Yeah, Toothpill is a great company. It's not, yeah, one of the creators and founders of the company is one of my mentors in airway and early childhood intervention with development. And I think that's one of the keys. It's really just paying attention from the moment that your child's born. If um, you want to make sure first at home, make sure that your child is looking for signs of sleep disordered breathing. So things start there, right? So it's you want to give your child a nutritious meal, like nutritious foundation. So for the nutrition, you want whole food foundation, right? As much whole foods as possible, and breastfeeding if you're able to, until the child can introduce solid foods. Then you want to make sure they're eating solid foods and that we kind of skip over baby food because children have natural gag reflexes to swallow regular food. Um, then you want to look at a child's breathing at night, and you want to make sure that they're breathing with their mouth closed and they're breathing through their nose. If there's any mouth breathing that's going on, that needs to be corrected immediately. Any teeth grinding, any snoring, all of that needs to be corrected immediately. And the sooner it's corrected, the better off the child's going to be. Because the longer that those breathing patterns go unnoticed, then the mouth and the oral cavity is going to develop based on those functional patterns. So if a patient is mouth breathing with their mouth open and they're not able to breathe through their nose, it's going to create a very narrow, long face, and it's not going to allow for enough space for the teeth to come in their proper positioning. But if we're able to have nasal breathing and the tongue resting on the roof of the mouth, then that tongue formation resting on the roof of the mouth is going to put pressure on the bone to grow in such a fashion that teeth will eventually have the space to come in the proper positioning. So things like tooth pillow, healthy start, MyoBrace, these little devices that kids can start in at age 2 can help them correct their breathing patterns at night and then correct their bites. And then I even start kids as early as 5 years old in expansion devices that are cemented in if needed, depending upon how narrow and small they are.
Wow, that's awesome. And the good thing is, because we are in an era where everything is very accessible to us, we are able to include these devices or these more natural,
Right.
holistic approaches early on before it's too late and they need something even worse. So I'm
Mm-hmm.
very grateful for that. And I feel like, holistic and natural medicine, functional medicine, they're being very spoken about.
Mm-hmm.
And that's the only thing that I'm very grateful for. Apart from all the toxins that we're exposed to on a day-to-day basis. So now that brings me to my next question about Invisalign. Braces and Invisalign, they almost do the same thing. I think Invisalign is more for aesthetic reasons because you don't have to have be able to see the metal in your face. You can it's clear, so even when you're talking, it doesn't look like you have something in. But what's with Invisalign that we don't know about as patients and consumers?
So I think my, opinion on braces versus Invisalign, I actually appreciate Invisalign a little bit more because the teeth are not bound by that wire that kind of locks everything in place. We do have a palatal suture. We have cranial bones in our face that need to breathe and kind of move in order to function properly. So when everything is bound by a wire with the brackets, I think that can have more dysfunction on the rest of the body. So I do
Mm,
appreciate the fact that with Invisalign, you can take it in and out.
mm,
However, I think where the Invisalign can get people in trouble, and especially things like Smile Direct Club or some of those offshoot brands that don't have an orthodontist fully present on your case and looking at everything as you could, how you buy impressions and you have someone in the background looking at your case. I think some of the issues that come in play with that is when the teeth are moved in such a way that the jaw is no longer happy in that space. For example, I
mm.
had a patient that got Invisalign done just to move her teeth a little bit, and she ended up with a locked jaw for 5 years and could only open this much. It
My
doesn't happen
gosh.
often, but I think it's a product of moving the teeth in those little space and moving those teeth just a little bit, put them in place where the jaw is no longer happy and it has to
Mm,
compensate somehow. And for her body, that's how it compensated by limiting, now the jaw can't open anymore because it's in a position that it's not happy and it's not able to function properly. And that's
yeah.
the thing. Dentists and orthodontists need to connect the teeth with the tongue, with the jaw joint, with the airway. It all needs to be taken in consideration, not just the teeth and the smile.
Yeah.
And most people probably do all right, but there's enough of those one-off cases that will keep you up at night, and you just
Yeah.
really want things the right way and not
Right.
cause that. And
Yeah.
because sometimes dentists can cause more harm on patients just by trying to help them, you know.
Mm,
But
yeah, definitely.
I think just assessing your airway and your jaw joints before just walking straight into getting a little quick fix with Invisalign would be
Yeah.
helpful. Mm-hmm.
Yeah, I think it all comes back to education, right? Asking your doctor the right questions. Why do I need this? What is the actual root cause of it? How did I even get here? Um, I think there's some very basic questions that we don't tend to ask ourselves on a day to day basis. I think we're so worried about how can I avoid this right now? And it's more of a quick fix rather than a more long term fix. Um, and ultimately, it hurts our entire body, right? Because one thing affects the other, and then the other, and it just goes on.
Mm-hmm. And a lot of the
Um,
times, oh, I'm sorry.
oh no, no, go ahead. Sorry.
I was gonna say a lot of what I find in dentistry that is a little challenging is that most of the the things that actually fix someone or help them, it does take a lot of time. It's not something that's going to happen overnight. It takes time to, rewire the brain and undo what's been done, replacing mercury fillings, getting detoxing from the metal. All of these things take time because it took time for people to get to that positioning. So it's hard to cope with in our day and age where we're just so used to instant gratification and wanting things done right now, and we want to just it's just a different lifestyle that we've created for
Right.
ourselves. Mm-hmm.
Yeah, we're definitely rushing into solutions and cover ups just because we don't want to deal with it, we don't want to see it. But then it's going to keep coming up until we actually fix the root of it. There's a saying, right? The same problem is going to come back again until you address the root, which is often changing ourselves.
That's just like lessons. You'll see the same lesson over and over again. Like, why am I going through this again? Like, didn't I already do this? But I feel like God puts that into your place until you learn your lesson. You're going to see it over and over again until you realize you have to pick. It's a test. You have to pick a different choice, right? So I think some of this happened to people when they were kids. They didn't have a say so when they went through all of this, and they do now. And so it's harder to when some of the things that you're dealing with as an adult has nothing to do with what you decided, but what someone decided for you. So that can also play a role into someone's ability to heal.
Mhm. Yeah. Yeah, definitely childhood upbringing plays a huge role. And I think just like how you said, to undo the damage, it takes even longer. I think whatever was done in childhood or during upbringing, that also the rewiring also takes just as long, because we've been taught things the traditional way, and now to believe that there's another route, another choice that to take to even grow further in life, that requires a lot of resilience too. Um, and I think this is probably a great segue to the next, controversial topic in your field is root canals. What's your perspective on that, and how do you think, or how do you counsel your patients into this decision?
So I think root canals is a little bit of a tricky subject, because people really want to bottleneck you into picking a stance. Like, do you believe in root canals or do you not believe in them? Um, and I think that can be that's challenging as a practitioner, especially with everything we've been taught, what we've learned, and what is the standard of the American Dental Association. So I think that I can tell you what I've seen. I've seen a lot of infected root canals. So most of the time when patients are coming to me with a problem with their tooth, it's usually a root canal that was done previously that is now reinfected. Some of them have had it retreated multiple times. So that alone, just that anecdotal evidence shows that there is something going on with root canals and their ability to truly get all of the bacteria out of the canal or the surrounding tissues around the root canal. So root canals, if there's a tooth that's infected, an endodontist will go in and they will take the nerve out of the tooth and fill it with this material called, they'll clean it with bleach and some other materials, and they'll fill the root with what's called gutta percha. However, they just fill the main roots, but there's thousands and thousands of little tiny vessels that are at the ends of the roots, not just the main root. And it's really hard to fully close off that apex, which is the end of the root, right? Um, so there's thought that there's still bacteria in there and still, you know, pathogenic microbes that sit there at the root of the tooth. And if it sits there long enough, it causes your immune markers to increase, and for some patients it does cause more autoimmune and health issues. It contributes to those problems for them. I've I don't think it happens in every patient. I think it depends on a patient's toxic overload. It depends on, I think it depends on a lot of things, like their experience with that root canal, because yeah, how many how stories have you heard about someone getting a root canal and how it was super painful and it didn't go right? And, it's a very vulnerable position to be in when you're in pain like that. Um, so yeah, when there's a root canal, when a patient comes in with a root canal that's infected again, they have two options. They can either go back to the endodontist and have it retreated and the infection clears up, or we will remove the root canal completely, the tooth entirely, and we clean out the bone and graft and that kind of thing. But I do believe maybe in some patients, they have no other issues with their teeth, no health issues. They have one root canal, maybe they're okay, right? Maybe
Mm,
they'll be fine if they regularly detox and that kind of thing. And there's things
yeah.
you can do to help lower the load, but it is a dead tooth that's in the mouth.
Yeah.
So, you know, lymph and blood flow used to flow through there like a normal pathway, and then it gets blocked where that tooth is. So, for some patients, it is better to have that tooth removed and cleaned out, and they do feel better overall.
Mm.
Hmm.
So, um, once a tooth is removed, does that mean there's pretty much no tooth there?
Yeah. Hmm. Yeah.
Um,
So,
yeah.
what was your question? You had
Oh
another
no, I was just
question?
gonna say that. So once the tooth is removed, does how does it affect that person? When they're chewing, obviously is the chew going to be as obviously it's not going to be as it was before, but are they going to be able to chew down the food to the extent that it needs to be?
Hmm.
Obviously their smile is going to be a little off, so there might be issues of confidence. So there's a lot
Hmm.
of, I think, um, like things that affect the confidence, right? But what's going on internally? Do we even need that tooth? Do we even need to put back another tooth in there? What are some options?
So, whenever we go to remove a tooth, um, there's a couple options. You could have the tooth removed, and then you could have what's called a removable partial denture. So it's a little tooth replacement that you take in and out that will just snap in between the other two teeth and then snap out. I think it's safe. Yeah. It's an option for some people. There are some people that just do not want something else in the body. They want the tooth removed. And um, if someone is having a lot of health issues, sometimes I will recommend that. I will recommend, let's get this tooth out, let's get the infection out of the bone, and let's let you heal first. And then let's see how your health improves before we decide to introduce something like an implant. But I think when it comes to I think it'd be important to talk about tooth removal. When it comes to removing a tooth out of the mouth, especially one that was previously root canal treated, or a tooth that's infected, which would be the only two reasons why we would remove a tooth. We wouldn't remove a healthy tooth, right? Usually we're removing a tooth because it's infected. It's very important that you take the time as as a dentist or as a surgeon to remove all of the infection out of that bone. Because if you have infection in the bone, in the jawbone, you're going to have infection in the rest of the body. There is no separation. So when you take a tooth out, it's important that you remove the periodontal ligament, and that we as practitioners spend time cleaning that bone, and we continuously clean it until we get to healthy bone and healthy blood flow. And then we have to graft properly so that like you take a tooth out, and then sometimes people will close everything up, like, just want to close it up, but that can pull on the tissues, and sometimes that can affect how the tongue can function or how the cheek functions because you're pulling. So you want to decrease that pull and make sure you build that ridge back up and let that heal. Sometimes we're able to do an implant immediately. So we're able to clean the bone and get to healthy bone without a lot of tooth structure, without a lot of bone missing. And we're able to get a ceramic implant placed the same day and then heal everything. Sometimes we have to take the tooth out and clean the bone, graft, and then come back 6 months later and determine if we can do an implant. I'm always an advocate for an implant if it's possible for the patient, because when you remove a molar, let's say you take out one molar on the lower right, you only have 4 molars on that side. So you just remove 25% of chewing capacity on that side, right? Because your molars are the ones that do the chewing mainly. And the only reason the bone is there is because you have a tooth there. So if you remove that tooth and you graft and you put nothing there in 10, 15 years, that bone, even 6 months later, that bone is going to decrease. So it'll slowly start to resorb. And as that resorbs in this area, you have the 2 teeth next to it, and the bone starts to resorb on the back and the front end of the two teeth next to that tooth that was removed. So sometimes you can have issues with the teeth next to the one that was removed, or teeth like to touch. So if you remove this tooth at the top will slowly start to creep down because it wants to hit something. And sometimes it wants to touch. And if it's this one moved, it'll slowly start to creep down, and then it'll affect your bite, right? So there's changes that, I think the body can adapt pretty well. It's just like people will get their appendix removed. Some people get their appendix removed. Is it a lifelong, death sentence? No. Like, their body adapts to not having an appendix at some point, right? Do we want our appendix removed? No, we do not. But, the body will adapt eventually, right? So, it's not the end of the world if you can't get something replaced, but I think it is important that patients understand why it's important to consider replacing it with something. And, we don't know, there could come up something in 20 years about ceramic implants, but as far as I know today, and is that ceramic implants are more biologically compatible for the body. And I've seen it too, the way that the tissues adapt or on the implant, and everything looks very healthy. And then eventually you get a tooth put on and the patient can chew properly. It's never the exact same as a tooth, but it is a pretty good replacement. Because right now they're still trying to regrow teeth. And I think in a couple of years that will be an option. But for now, implants is the second best.
Yeah, it's very interesting. And a lot of the things that you have, spoke about over the past few minutes that we've been talking, you always you reiterated, we look at the overall health, or if that person has certain health issues. It's interesting because I've visited just traditional dentist offices many times, and no one talks about this. What health issues do you have? What underlying health issues do you have? It might be on the intake form, but then once you get into the office, it's never spoken about again. It's just like, why did I even put it on the paper? Was it just like a formality? But you talk about, do you have any underlying health issues? Like, if that person has immune issues, then we don't do this. If they don't, then maybe it's a potential option. So it's interesting that it is holistic, and it's supposed to be holistic. So when it comes to prevention, we talk so much about fluoride, at least in the traditional world. I know in your space it's probably a bit different, and if not, you could talk to me about it. But when we talk about cavity prevention, because it sounds like from our conversation, cavities are pretty much the root of all evil. And so how do we really prevent them from happening? Not just cavities, but in general, any oral health conditions, right? How do we prevent those from happening? What are some good hygiene practices that we should all be looking into on a day-to-day basis?
Good question. Because I definitely see problems with cavities in children for sure. Which I think is still a bit puzzling for me because sometimes I'll see that in patients that are extremely healthy and do everything right and they still end up with cavities. So I think there's a lot that we still don't know um, about how cavities are exactly caused and what exacerbates them in one person versus someone else. I think there are genetic pieces that play a role. However, I always go back to the diet. I think, especially in the United States, I can't speak for other places, but I think we're battling an issue with the nutrition in our food because of how our soil, like the nutrient depletion in the soil. So we could go down the rabbit hole on the food chain, but I think eating as many whole foods and nutritious foods as possible is best for the body and for the teeth. Because if you are lacking in nutrients, the body will pull it out of the teeth. Okay. So, you want to make sure that you're up, you have enough vitamin D levels and that you are getting enough vitamins and nutrients from your food. Um, I recommend not only a whole food diet, but an animal based diet as well, animal product based diet for the most part. I think that's what I've seen is best for the teeth themselves versus, vegan or vegetarian diet. Some people can get away with it, like I said, in any situation, but what was I going to say? So, yeah, your diet is huge. You want to stay away from sugars. You want to stay away from if for patients if they need sugar, I recommend honey, maple syrup, and dates. Try to sweeten everything with as much natural sugars as possible. Um, Sticky foods. You don't want to really eat like dried fruit and then just let it sit on the teeth, right? You want to make sure you clean your teeth after eating sticky foods. And sometimes that can be a reason why people get cavities because they don't eat enough crunchy vegetables or crunchy or hard things that will naturally clean the teeth. Um, One thing that I always do first thing in the morning that I always do right when I wake up is I tongue scrape. I always talk about this because I think it's like so important. So the first thing I do is my eyes will be closed and I'll wake up and I'll tongue scrape. And that is huge because at night, a lot of toxins will exude on the back of your tongue. And it's important just to clean that off before you ingest something else. I think it goes a long way. Um, there's also things that help, like ancient techniques like oil pulling. So if you want to oil pull in the morning for 20 minutes with peppermint oil or something like that, that's very cleansing, very, very good for the mouth. Um, there's even probiotics and prebiotics, which help populate the flora with good bacteria that will work together to create a harmonious environment. What else?
Yes, absolutely. Let's talk a little bit about fluoride. Fluoride in the toothpaste. I think that's definitely a huge question that we are always battling against. There's so many different toothpastes out there. There's hydroxyapatite. There's nanohydroxyapatite. There's fluoride. Something new is always coming out. One day it's hydroxyapatite, the next day it's, oh my gosh, the sensitivity in your tooth is going away because of hydroxyapatite. And I think it's never one size fits all, right? So what toothpaste do you even recommend?
So yeah, I mean, there is a lot. Like when hydroxyapatite came out, it was like, oh, this is the best toothpaste, and then it was like, oh, this is the blood-brain barrier, and now it's causing brain accumulation. And I think it's hard. Like dental materials and the materials that we use are very difficult to figure out. But um, for now, I definitely do not use fluoride at all. When it comes to the issue of fluoride, so fluoride, what it does is it takes hydroxyapatite crystals that are in the enamel and it replaces it with fluoroapatite. So it makes it does make, when it's topically applied to the teeth, it does make them more hard. It makes the enamel harder and more resistant to cavities, but it also makes it more brittle and prone to fracture, depending upon how much is used. And so topically, when you put fluoride on the teeth, it does help prevent cavities, but it also gets in the submucosa and gets into the bloodstream, and it negatively affects other systems in the body, in my opinion, and also in research. That's why I do not recommend it. And I also definitely do not recommend fluoride in the drinking water because it's bad for our teeth and for our bones. It affects our bones and our pineal. So, yeah, the toothpaste that I recommend, I like Risewell. There was a lot of controversy on if there was heavy metals in their toothpaste. I think it was proven negatively. It was proven, debunked or whatever. But I like Risewell, Thieves, Thieves tooth whitening toothpaste. I also like Figs, Feed Your Good Guys, FYGG, the pediatric dentist, the lady who came out with that toothpaste. I also like Dr. Jen's toothpaste, which has the highest concentration of hydroxyapatite in it out of all the ones, I believe. There's a couple of other ones, but that's Boca's another one. But yeah, I definitely can't go back to a fluoride toothpaste at all. And that was a hard one for me in dental school. When I first learned about fluoride, it was very difficult for me to integrate into my mind because that was our solution in dental school. Someone had a bunch of cavities, you would give them what's called Prevident, which is a prescription strength toothpaste with fluoride in it. And so all my patients in dental school were on Prevident. So I was just handing it out like it was candy, and they still had cavities. They would still come in with more cavities. Yeah. So, and I think even people that eat healthy, sometimes they still get cavities if their gut is not well, if their gut, because that's where we absorb our nutrients. So I think getting the colon and the small intestine and large intestine and our whole digestive system, maybe giving that some attention would help how like the strength of our teeth. And I also there's controversy with flossing, but I definitely floss every night and I use cocoa floss. So yeah, I recommend that.
Yeah, I think those are very, very simple to incorporate steps. And as we're coming to the end of the episode, if you could leave our listeners with a few insights about their oral health that might really change their perspective forever, what would they be?
um, I would say that I really do believe, after being in the position that I'm been blessed to be in, I do believe that the gateway to the rest of our health does begin in the mouth. So it begins with what we say, what we eat, what we drink, and how we breathe. So looking at all of those things is I think just realizing that everything is connected. So
Yeah.
if you want to be healthy and you're shooting for longevity and something and living a life that is of quality, then it's important to find somebody that you trust to help you make sure that your oral cavity is nice and healthy so that the rest of your body can
Mm,
be, and
yeah.
make sure that you have a good relationship with your dentist so that you can be with them and they can, that you feel heard and seen. Because I think that's also extremely important. A lot of people have a lot of negative experiences with dentists and they just block it out because it's too much to deal with sometimes. So, yeah, I don't know if that helped or not, but
No, it does. It does. I think we're often scared to go into the dentist's office. Either it may be for like the actual tools that are going into us, or the random recommendations every time we walk in, or maybe even the bill. So there's always something coming up. So I think that can really scare us to go back into the office. So you're right. Having a good relationship really helps. I think we spoke a lot. We spoke about a lot of things, Dr. Carlie. Uh, and some of these are not spoken about until something comes up. But I think having that awareness that some of the basic things that we could do that may take less than 5 minutes could really, leave us with an everlasting impact, then why not? I think this episode was just that. And I can't wait for our listeners to listen to this and really, gain a lot of wisdom. I'll share your Instagram handle. Are there any other resources that you're active on that you would like our listeners to go to learn more about your practice?
Maybe just my website.
Yeah.
I have two different websites. One is related to my Instagram handle, and the other one's just drcarlieamore.com. Yeah, and then people can reach out to me if they have any questions. I have no problem reaching out and chatting with patients or
Yeah.
just people. So, yeah, there's a lot of good information out there, and um, I don't know why I just want to bring up this book. There's this book called Pottinger's Cats. That's a really good book if anyone is interested in reading. It talks about how our diet, it talks about cats and how the diet affected these different generations of cats and their dental
Wow.
facial, um, the structure of their face. And it's just very interesting. So it talks about how our nutrition plays a role in how our teeth come out, basically. So,
Yeah, that's a really good point. But I'm very happy that, we got a chance to speak today. And I'm
yeah.
very thankful that you're actually very responsive on Instagram. So, like you said, for those who actually have questions and, want some clarity, I think you're definitely a great go-to resource. And this was an amazing episode. So thank you so much for your time, Dr.
Thank you so
Carlie.
much.
Yeah, thank you so much.
And getting to do this with you.
Yeah, I hope you enjoyed it. And I hope our listeners enjoyed just as much as we did.
Thank you. Me too.
Be minimally processed.